The Venetta Mwegella Foundation continues its mission of promoting mental health awareness in Cameroon, a country where mental health challenges continues to be on the rise. According to the Ministry of Public Health, figures have moved from 10,000 in the year 2000 to about 25,000 at the moment, a situation which needs urgent attention. With the Mental Health Month celebrated in the month of May, we shall be looking at what the Venetta Mwegella Foundation has been doing in the year 2023, as well as projections into the rest of the year. Stay with us. My guest is a primary care provider, psychiatric mental health provider, and mental first aid instructor. She is also the founder and CEO of Prima Healthcare Systems and the Venetta Mwegella Foundation. She is a licensed provider in the states of Georgia and California and has her roots deeply embedded in the healthcare sector in Cameroon and the United States. Her passion is in preventive medicine, gathered from years of experience. Her goals and vision are to raise awareness about ways to achieve a healthy mind and body by identifying, understanding, and responding to signs of mental health illness and substance use disorder. Her foundation has and continues to do amazing works in the United States and Cameroon by shining the spotlight on mental health awareness and providing economic support for single parents. She is making her comeback for the third time in this edition, in this program, Indepth, and it's a pleasure once again to welcome Venetta Mwegella. Thank you very much for joining us once again.
Thank you. Thank you so much for having me.
Yeah.
It's always a pleasure.
You have been in Cameroon. Has Cameroon, I know, is very busy for you.
Yes, especially this trip was a very short one. And it's been just back-to-back activities. But it's been very productive. And it felt like 3 weeks worth of work just for 5 days. So I'm very, 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 very comfortable with the work we've achieved so far.
Okay, you are just from Yaounde, where you conducted the second session of the Check Off from the Neck Up campaign in Yaounde in Ikundu. How will you assess the campaign?
So it was an amazing campaign this time around. The numbers actually shocked me. I did not realize how much the word has been spreading so far. We had a total of about 48 individuals. This is not the typical workload for an 8-hour shift. Typically, people see, I think if it's maximum 30, people in a day, but we saw 48. So for me, that spoke volumes. That just made me know that the awareness piece is actually going out there. Because initially, mental health concerns are surrounded by multiple layers of stigmatized information that people don't even want to associate themselves with mental health disorders. But when you begin to see people showing up to get screened, then you know that we're breaking that barrier. The stigma that is what's holding them behind is no longer there. So they are now able to show up and say, hey, I want to check and see how I'm doing, how my mental health is. Is it optimal, or are there things that I'm struggling with that I don't even know of? So many people came just because they heard and they wanted to get screened. They don't really have anything per se that they're concerned about, but some people already have prior diagnosis and they're just coming because they stopped following up. They couldn't afford the treatment, so they stopped. So they saw that because this was free to the public, the foundation paid for it. So I was very, very impressed.
All right, now, what do you think must have enabled this change of mindset from people sitting back when they hear about mental health awareness to them now embracing it and trying to seek consultation?
it resonates in the deeper parts of you when you hear someone talking about the things that you're facing. Because I was on CRTV on the 6th of this month. 6th of June. We were talking about pollution, and I came in to talk about mental pollution. And the feedback was, oh my gosh, everything you're saying, we relate, we relate. When individuals start relating to the core issue, when they can relate to it, it begins to break down those barriers, and you begin to see yourself as a normal person. Not that something is wrong with you, just that you have a concern that you need addressing. And that's it. So I feel like the more people are relating to the information. I'm from Cameroon, you know, I'm not just a foreigner coming from somewhere, coming to talk about this. This is my country of birth. So I know exactly what the people are going through from a point perspective of an individual who has lived here before. So I understand how the challenges could get daunting and people have difficulties navigating. So the way I put it out, the information, it's in a way that they can easily relate. Once you can relate, then you see yourself in it, you're able to show up and get screened, I think.
Okay, this campaign, just like the last one held at the Cameroon Baptist Convention Health Center in Ikundu, when you look at the collaboration from the CBC experts, how will you rate the collaboration from the last time the campaign was launched there?
Okay. So the first time I was there, that was the very first, that was the pilot location, because we have a memorandum of understanding where I can see patients at all the locations. So in December, we were here at Bopi, and we'd gone to Mutengene. We were actually supposed to be going to Kribi, but Kribi doesn't have a department of their own, so they were supposed to move staff from Douala to Kribi just for the event. And it became a little bit, the logistics, the timing and everything, and I had very limited time. So we decided that since Yaounde is one of their biggest locations in this area, we're going to go ahead and just do it again there. And the collaboration has been amazing. I actually was very impressed. That's how we're able to see 48 individuals in one day. I cannot see 48 patients, especially when you're screening for mental health. So their collaboration has been amazing. The staff on board. And we were blessed with 3 students who were also doing their clinical rotations. So we had extra hands on deck, and we were able to pull this off based on the organizational skills of that particular department. I've been working with the lady there, Hermine. She's amazing. But we work beyond this campaign. For example, if I show up today and I see patients, I still follow up with the patients when I'm away via tele. So we do what we call telepsych. It's one of the things that I set up there. We got the internet connection on the device. So while I'm over there in the States, I still follow up with the patients. So I work with her, you know, every week or every 3 weeks or 4 weeks, depending on the schedule we have. So our relationship is very cordial, and the collaboration was amazing from the top down. So everybody is in alignment with the vision, and they're seeing, of course, the impact that it's having. Yeah.
Now, away from this particular campaign, there's also another project the Venetta Mwegella Foundation is working on, which is the Sports and Arts and Culture Jamboree. And this particular one is focused on arts as a tool for mental health. Can you throw more light on that?
Sure. So as we saw earlier on, we've been focusing more on the healthcare setting where people come to the hospital. And how about the people who are just everyday individuals in the community who just want an everyday environment where they can just feel really, really in good state of mind, right? So we were thinking about it, and while I was exploring some options about using other forms, other ways to really relate to individuals, because we know that everybody is different. People relate to information in different ways. So we wanted to use different modalities, not just the structured way in the hospital where you show up to come and get either your therapy session or your visit and your screening. We wanted to see how we can kind of try to embed this activity in the community. We bring it to the individuals, for the community, by the community, so that we can bring that sense of well-being that we've lost. people don't really have the normal flow of life that they used to have, like being outside and doing the things that they used to do. And that's why we went back to use that. So the PVA department was working. They did an amazing job with theater arts, and we saw a lot of work that they did, and I was very impressed. So I decided to work with some graduating students there to pull some really major stuff off. So they're going to be helping us a lot with that, but we wanted to bring it to the community, because when you want to have optimal mental health, it's not a one-time visit to the hospital. No, it's not something that you're coming, we have a tumor, we remove it, you're done. No, it is an everyday thing. We want you to wake up feeling normal, go to bed feeling normal, and just living an everyday life that is normal. And then also learning skills to cope with the stressors that will come. Life happens, they say, right? We're not immune to that. So how do we cope with it when it comes? You know, I always say when you change the way you look at things, the things you're looking at will change. Exactly. That's what we're doing, giving people other perspective of looking at the same thing. And then the light bulbs are going to go. It's like, oh, I didn't think about it in that light, right? So some people might like to read information. Some people might like to listen. Others might like to see it like in theater form or art. I had some students that I talked to, and we're looking at art, how individuals used art to express how they were feeling. They didn't know the words to use. Somebody with a broken heart, they don't know how to say it, but they can paint how they're feeling, and it shows. And we also use art for diagnosing, especially children. So kids have a hard time using the vocabulary is not strong. They too don't even understand what's going on, but from what they draw, you can tell. From the colors they pick to paint what they're painting, you can tell a lot about their mental health. If it is the state of optimal, a state of good mental health, or if they're having some disorders or challenges that they're dealing with. Somebody's painting and using a lot of dark colors or black, you know, you want to start looking at deep things like depression. If you want to be looking at somebody who is always looking at the painting is always about killing or, you know, somebody dying. So you begin to get into the mind of that individual. And that's why I want to bring that out too, not just the typical way of going to the hospital. Yeah.
Now, in what ways does performing and visual arts contribute in tackling mental health challenges?
So for now, it's we're using it to raise awareness, and the piece has always been the awareness piece, where when people know better, they do better, right? Ultimately, if I use different forms, let's say we, if it is just a cultural activities that we do, and we use that to send that information, it is going to be better assimilated, but more than if I sit and I do a lecture. If we act it out, because one of the things we plan on doing is getting in the community and asking them, what are their challenges, what are they facing? And then we can use them in the form of theater to act out the solutions and bring it to light. And I feel like when we do all those things, people get the information they need to begin to relate to that information better. We don't want to take one modality. And when you are able to understand what you're going through is the very first step to healing. When you begin to see that communal living, that togetherness with everybody else, the people that are in your community, it brings this sense of well-being that you can't even get by taking, you know, medication. It's natural. You feel relaxed. You feel at home. Stress level goes down. Anxiety goes down, because this is my environment. You know, I'm not afraid. I know this individual. So those are the kinds of things that we want to do, because we're going to bring games like, you know, things that we used to do when we were growing up, and that brings fun memories. And those fun memories you're sharing with the people that are in your community. So it just helps with the overall sense of mental well-being. So that's the goal we're trying to achieve with that.
Now, what is the target population? Is it just around Boya, or is going to expand?
We're going to do it specifically in Sopo, Great Sopo, Boya. That's where I'm from. That's where I was born. And I feel like they say charity begins at home. I just wanted to make sure that we're taking care of our home. Yes, I want to take care of my country, but I feel like, just especially when it came to the community, that sense of belonging, that's where I feel like I belong. So for me, it's like, yes, because if I test it out in the community where I belong, I can easily understand that community well. And then once we, depending on how it turns out, we're going to now extend to other local communities. Because when we're doing what we're doing, we're targeting that particular community, and it's more specific versus being general. So for me, I feel like it's almost like tailored for that particular, and different communities will have different things that they focus on.
Yeah.
And we want to respect that. We're not imposing and telling you what you have to like, but we're coming to bring to light that which you're already doing and to use it to create that sense of overall well-being. Mental health awareness is not just for the people who have challenges, because if we have optimal mental health, we want to keep it that way. And how do you keep it that way? By waking up every day in an environment that is conducive for you to have that overall well-being continuously. So
now you have met with some arts creators concerning the jamboree. What has been their vision about it, and how they hope to implicate themselves practically in the field?
amazing, amazing. So I went straight to the source of the source of the talent, which is University of Boya, the PVA department. We went straight there, and we are currently working with level 400 students, those actually that are getting ready to graduate. I went to University of Boya as well, so that's almost like home to me. So we're working with individuals who are getting ready to get out there into the field. So they've been trained, and from what I saw, because I did the movie premiere that they did at Allianz Franco, and I was very impressed with the work they've been doing. So we have resource persons coming straight from the department, and they're willing to share their expertise. They're willing to share what they know. So in art is the best way, second to maybe a clinical setting, to begin to bring that kind of a well-being we're seeking. So I saw that they were really talented and passionate, and it's something that they were looking at, because one of the movies that I watched was actually surrounded around gender-based violence. So it was an individual who was portraying her story. It was an actual true story. That could be an individual in the community that we are targeting, right? So how else can we really bring this home? When you see a familiar face talking about their story, what they went through and how they surpassed it, and how they're telling other people to avoid the traps or the pitfalls of what they went through, you can't get that from just a clinician telling you, somebody you don't know telling you. But when your community person is saying, I've been there, done that, bought a t-shirt, I think people get the story better.
Okay, now apart from the visual arts of things, there's also sports, and there's culture. What will we be expecting practically on the field?
Okay. For the sports side of things, we know everybody loves soccer.
Yeah.
Everybody come to, like, political barriers break down, cultural, even religious, everything just melts down when there's soccer. There's this sense of togetherness. And we saw that in our country recently when we were hosting the Nations Cup. Everybody was just together. It didn't matter what was going on. So I had to tap into that. So definitely soccer. And we're also going to do local games that we used to play growing up. Things like, I'll call it in the local ways we used to call it. Dodging, even though they're saying dodgeball, dodging, tabala, CISO, right? And I personally, I said, if I was here, I would have done dodging. I would have been part of the dodging team, because that's something that I really liked. And when I always tell my patients to, one thing that I do across the board, because I'm also primary care as well as psychiatric mental health care provider, I always push for exercise. Because when you exercise, you release these wonderful endorphins that just kind of make you feel good. And it works for physical health as well as mental health. That is one tool that I always prescribe. I'll say, hey, you got to exercise. Now, when we are exercising, we're jumping, we're doing the CISO, we're exercising, we're getting the communal impact, and we're also getting the physical well-being on the inside of us when we sweat, when we do all of that. And then also we're gearing towards getting a prize, because the team that's going to win is going to get a prize at the end of the day. So that also helps them to motivate. Yes. So there's that, it's that three folds of joy coming in, you can't beat that. And you're going to do, you talked about the age, we're also incorporating the draft for the older folks. They will sit where they normally sit to play their draft, and then I mean, I'm so impressed by what they came up with. So we'll be involving them too. They'll play that. Even Bizet, you know,
Yes.
I had not heard that in a long time until we're
Yeah.
exploring all the things that we normally used to do when we were in the communities growing up. Just imagine that. I think the only thing we're going to miss is like what running in the rain. And we also there's one
Yeah.
form of art that we're going to be using too, and we explored the option. It's like, okay, what if it starts raining? Because an individual is just going to be sitting there. He called
Yes.
it, I think, I forgot how he called it, but some technical name. So what if it's raining? That individual is just going to sit there and say, yeah, whether it's raining or the weather is good or bad, the individual just stands there. It's something that we're going to stage along in the community. You see as it unfolds, but we have a lot packed.
Now, let's talk about the therapeutic conversations with Ven, which is a podcast you told us last time was going to get produced. We already have the very first edition of that podcast. Just tell us about this first edition.
Okay. So I think total we have the making of, and then we have two extra episodes already every Monday. So far I we have that coming up. So therapeutic conversations with Van was just one of the platforms or ways that I decided to also reach out, but not in a very formal, structured way. In my practice, you have to follow guidelines. You have to work within a certain parameters. You can't just go off rogue and do whatever you want to do because everything that we do will prescribe has been tested and tried and researched significantly because we're talking about human life. So you make sure that you're not just doing whatever you're doing. Everything that you're doing has met every single criteria that is needed. So that said, in the podcast, I can say whatever I want to say, like my personal opinions about stuff, because we all do have personal opinions that might not be in alignment with what the guideline says. However, in the setting where you work, you might not necessarily want to say those things
Those
there.
things, yeah.
And we have also to respect the beliefs and the choices of our patients. So we don't push personal beliefs. I tell you what the guideline states. I tell you what it is that the practice is based on. And I tell you what we have. And then you tell me what out of that you would like to achieve. If you don't want to take medication, I can force you. If you want to take medication, I can stop you. But I could say for myself, I personally don't take meds, but I cannot tell that to my patient because it's coming from a personal viewpoint. And I have the right to choose and do whatever I want to do. However, I also respect the rights of my patients and what they do. So I always say in the podcast, I said, it's not a diagnosis or a prognosis or anything like a prescription. We're just having a therapeutic conversation. Because I might have a point of view that is different from yours doesn't mean you're right and then I'm wrong, or that I'm right, you're wrong. But it could mean that there are areas that are great that we need to explore. Yeah. And I want to give that kind of window, that kind of opportunity. And it all started because I like to go in depth. It's amazing I'm in depth. And I like to go in depth with concepts that are abstract, things that normal people don't wake up talking every day. I like to challenge the beliefs and just go look at it. Let's look at it together. Right? Because they always say it's hard for you to see the picture when you're in the frame. Yeah. But how about I throw it to you and then you reflect it back to me? Because if we put the number 69 right here, I would say it's 69 and you would tell me all day that it's 96.
96.
And we will never come to any agreement when we're looking at it from that way. But if I move from here and I come to where you're sitting, I will see your 96, right? If you leave there and come over here, you see my 69. And I believe life is that way, with a lot of other concepts. Let's explore it. Let me see from your viewpoint, and then I share with my viewpoint, and then we can all come and mix it all together and then get a better understanding. Who knows, even make a new discovery as far as thinking and how we approach the topic per se. So that is what we're going to be looking at. However, I also kept it in an area where I'm very familiar with, right? That is not too far away from what I do for every day. So it's almost like I'm working with say if your job, what you do is your passion, then you'll never work a day in your life. So for me, it's just my passion, other ways of looking at it. My goal, though, is that I'll begin to spark a thinking process in individuals that was not there before, or making them look at their mental health and well-being in ways that they didn't look at it before. And when we begin to have that understanding, maybe, just maybe, our lifestyles will be modified such that we will not be facing the challenges we're facing. Because a lot of it, especially mental health, is about perception, how we look at things, right? And then how we let it affect us. But if you are taking care of that already, you might not need to come to the hospital. You might not seek any of those, you know, care for anything of that. So that's my goal: prevention.
Now, what's your assessment of the feedback from the podcast?
Honestly, I've been so busy traveling and being around here. I've not really sat down to look at it from individuals who I know that I've told them to watch. They said it's amazing. You get things like, oh my gosh, it's amazing. I just learned this. I just learned that. But again, when you know someone, they might not. Very few people will want to rock the boat and be like,
the critical part may not be there.
Yes. And I always say, hey, I would like to know what you're thinking about it. That's why we're having, it's a therapeutic conversation. It's non-judgmental. It's a space where you can feel free to just speak your mind. Nobody's going to know. There's no right or wrong or good or bad. It's just what it is, and we're exploring. But what I would do is, based on the platform, it's on Spotify right now. My intention is to get it on Apple, on iTunes as well. So they generate their feedback too, so that we get it from them, which is better, is we cannot influence it. So it's going to be whatever it is that we're getting, the statistics from them. So I just want to give it some time so we can gather enough data. I feel like the data is not enough to make a conclusion, to draw, because I didn't even do a lot of publicity about it or pushing it a lot. So I believe later on when I go back, I'll focus on actually putting it in the ears of so many other people so that they can come to look at it. Doing an assessment now might be a little premature and not fair to the process. So I think we can just give it some time and then see how it works. Maybe even 30 days or 60 days, why not 90? Okay. And then we'll get a better perspective.
The Venetta...
if you don't mind, I'm sorry. No, for the first time, I'm going to interrupt you. I want to get your feedback on air, like genuine, ultimate feedback. I put you on the spot. That's what I want, non-judgmental, free-flowing. Do you want to give me your feedback, what you want?
I've listened to it. Production-wise, it's well done.
Okay.
I'm not an expert on mental health issues, but I love the issues that you bring. So for the fact that I'm not an expert, I cannot really challenge some narratives.
Okay.
But I think the issues that you address are pertinent.
Okay.
And it's very common for anyone across the world to find his or herself in that particular discussion. So I think it's that way. But now I cannot be too critical because I'm not really an expert.
I get you.
Like you are. Sure.
I get you. So and thank you so much for letting me do that to you on the spot, because I value your assessment a lot. We've worked together for a while, and coming from you means a lot. And as far as the content, as far as the technical content, that's not even what I'm looking at. I'm looking at how it made you feel when you listen to the new information that you got. Because when I give the information, even though I try not to make it too professional or too like trying to cite works and stuff like that, I trust the content because that's what I do for a living. Yeah. So that part, I am very, very confident that the information is something that is, it might not be what your area of focus is, but I like the fact that you talk about the technical parts, because that's my weak point, like understanding how to put it together. Yeah. And I did it at home by myself. So I wanted to know if what I did, like putting it together and how it flows and how it sounds. Yeah,
the sound quality is good.
Okay, good.
Sure. And I think if you go on iTunes and Amazon, it will be Yeah, will be the platforms will not hesitate to take them. Yeah.
Awesome, thank you.
The quality is good.
That's amazing feedback. Yeah. Thank you.
All right, now the Venetta Mwegella Foundation is also focused on partnerships, and at this point in time, you're already looking at 1 or 2 organizations to partner. I want to ask you, how important is it for the outreach part of the foundation?
Okay, thank you for that question. I'm glad you're asking that, because that is a very, very pertinent part of the whole foundation. we've been looking, so far it's been a journey that I embarked on, and then I started just figuring out how to move to the next step. And then every time I sit in your chair, we put out a new thing that's going to come. And I feel like we're getting to the point where it's not going to be something that can be just me alone carrying all the burden, especially financially. There's so many people who want to give back. There's so many people who want to partner in any way, shape, or form to also be present in their communities, but they don't have the time to go and have a foundation made and have all of that done. They find a cause that they're very passionate about and then support in any way, right? So I've not explored that very well. My partnership with the Baptist healthcare system was to make sure that I use their facilities and that the patients have a go-to point because I'm not based here. Yeah. So that's how we achieve that goal. And the other partnerships will be an amazing way of letting everybody or anybody who is willing to reach out to their community, all right, by way of like supporting what we're doing, by way of a partnership, so that they can also, because most organizations have a social responsibility, yeah. And they don't have time to create a special foundation just to do that. So they go around and look at people that are already doing work in the communities and in areas that they also meet the vision and the mission, and then they support. And so that we're together, because when you do something alone, you don't get the impact you can get when you're doing it with multiple people, yeah. Or when too many people come together, and then the force is better. We can see that with the broom. When you have one broom, yeah. Stick, it easily breaks. It doesn't really, it doesn't, yeah. When you can't even sweep with one broom, one broomstick, right? Yes. But when you put it together, tie the bundle, guess what? You can clean the entire yard. There's no stone that thing cannot sweep, or no water that it cannot sweep, right? Even when you try to break it, you can't break it, yeah. No matter how hard you try. So I feel like that's just the same thing. It's about time we let other people come in any way that they want to come, any kind of partnership that they want to have with us, so that we can together do the work that we're doing. And especially with the outcome in Yaounde, it's getting bigger. I'm going to need more individuals that will come with me, so that next time I'm not going alone, yes. Right? Because then if we did 48 this time around, we'll be looking at 60 or more. Mm-hmm. So I feel like we need any kind of partnership, even with other hospitals, not just the Baptist hospital. I'm trying to work on something with the Southwest region. When you're working with the government, it's a little bit different. Yeah. The way you come with the partnership, different steps and everything is not the same as in the private sector. Mm-hmm. So we're looking at things like that, especially for Boya. That way we can actually see patients in Boya. So there's a lot coming up, just to give organizations or individuals to partner, and let's take this mission to another level.
All right. I would like to take you back to the launch of the opening of the Center for Wellbeing last year, where some seed capital was given to single parents. Mm-hmm. Has there been some follow-up on how their businesses have grown? About 1 year now. Yes.
That's also one of the pieces that we're also revamping. We're changing a little bit. We're restructuring how we're going to do that part of the outreach. But we have tremendous response from the participants, and things like that. I like for them to speak for themselves. So they've sent a lot, especially me coming now, they've sent a lot of information, telling me how their lives have changed, how I put a smile on their face, how they're able to pay the bills for their kids. And we had one recipient who, the daughter was sick in the hospital. She said, for the first time, I did not have to call somebody to borrow money. I was able to count that money and pay the hospital bill for my daughter. And it just brought the feeling in her that brought her to tears, because just tears of joy. And I would like for us to hear from that individual, like the messages and they themselves, how they're saying. But so far, they're doing so well that we're going to be using them for this jamboree. So we had an individual who we gave her seed money to get a machine. She learned how to sew, but she didn't have the equipment or the setup. So we set her up. We're going to use her for the fashion design, for the piece of the thing, right? Mm-hmm. she's going to be the one helping with coordinating that. Also teaching, because we're going to do classes, culinary arts. It's one that she makes yogurt. So we said during that part, we're going to teach young individuals how to make yogurt. So we're using these individuals because they are willing to give back. We give to them. So they're doing so well, and they've been looking for ways to give back. And we kind of incorporated them in this jamboree for this holiday period so that they can give back. And then we also have individuals who, you know, did other businesses that they always send me pictures and messages. I just haven't had time to upload them on our website, which is what I'm going to do, so that individuals can see the messages straight from these people, how it's changing their lives. And that's really the goal, to just renew their minds and transform their lives. That's what we're about. So it's been good. Now, the change that is coming, the initial seed capital that we gave was non-refundable, interest-free. That's it. We help you, set you up. And I kind of realized that I will not be doing individuals justice or doing the right thing, knowing from the literature that is out there and a lot of the research work that has been done, with just giving free money out. That's why when people win the lottery, there is a certain mindset that they haven't developed to handle that kind of money. We end up seeing them going bankrupt, even worse than where they were, because when they have this money just come upon them and they start doing these things, at times they don't really have that structure to handle that kind of money. So what we're doing now is we want to give support. We're giving interest-free capital, but you have to pay it back. Now that makes you work hard. That makes you know that you earned it. Because some people have a complex where they don't earn it, they don't value it.
That's it.
So I want to keep that value. I want to, because this number, the number now is small. It was easy for my staff to work closely with these individuals and guide them through the steps. But we do have it when the numbers grow, because we're about to do another seed capital donation and stuff like that. We might not be able to keep everybody under the microscope, helping them, supporting them through the way and guiding them. The weekly calls to make sure you're meeting your weekly goals, the monthly calls to make sure you're meeting your monthly goals. We might not be able to be so involved. Now, you have to get that motivation from yourself. When you know you have to pay this money back, you automatically will make sure that your business is productive to be able to pay it back. So that's the only difference that we're going to be seeing moving forward. But they do, they're very appreciative of the support, and they're doing amazingly well, which is what I'm really passionate about, just the way we've transformed their lives.
Let's look at the general situation of mental health in Cameroon and the world. We have seen the situation keeps increasing according to experts. The Ministry of Public Health here in Cameroon say that the figures are rising, and they are calling for more efforts to see how to curb the situation. What explains this continuous increase of mental health challenges?
In my personal opinion, I typically will not cite stuff that I've not really spent time researching to give actual numbers or anything or statistics. But my personal opinion, as someone who is a psychiatric mental health provider, we know that stigma has been the big thing that has been blocking individuals from accessing either information or services that could potentially benefit them. Now, when you don't have the information that you need to do the things you need to do to get your mental health checked or get it in a state of optimal well-being, which is the status quo, that's where we want to be. That's where we want to live. You begin to now neglect certain things that will definitely put you at risk for certain things. I don't want to call specific things because we have a whole array of mental health disorders and we can't even touch all. Now, when we have a shortage also in staffing, that's the issue in the United States. We have shortage in psychiatric mental health providers, even here. So when we have that shortage combined with the stigma and more people not getting screened, the numbers will only go up until we begin to address the things or begin to share the information that people need to begin to do the things they need to do to protect their overall mental well-being, to see the numbers start dropping. That's only one point though. We also have another issue of maybe financial resources. I might have an individual who is willing to get screened or willing, but they don't have the resource to achieve that. So that was another thing too. And then a lot of the issues that have been going on in this particular community or this particular in the country, or depending on the stats wherever. There's been a lot of changing. So many people are going through a lot of hardship, and that is always, always, always negative on your mental well-being. It doesn't. It leads to a lot of depression and anxiety. Not knowing what's going to happen, not knowing what tomorrow looks like, will make you feel really anxious, and you can even lead to depression and give up. And we've seen a lot of death by suicide, where people give up and say, you know what, I don't see any way out. I might as well just end this now. I cannot go anymore. So again, it could be economic reasons, staffing issues, lack of access to information, and a bunch of other things that are personal too. So,
all right. Now, you have always taught on the fact that physical health is mental health. What's the relationship between the two?
Contrary to popular belief that you think you can separate your mental health from your physical health, you can never do that. Without optimal physical health, your mental health suffers too. All right. In one of my episodes, which I'm going to encourage people to go listen, I talked about the mind-body connection, which is the base. I wanted to start with that because it kind of puts the foundational information where what you need to really understand. If I have lots of money in the bank, right? I have a good job, but I'm depressed, I'm down, I'm feeling, I don't want to exercise. I don't want to, maybe I'm binge eating the wrong food, ice cream, or lots of, because we know comfort foods are always packed with sugar and doing all of that. And for example, God forbid, I'm a diabetic. Guess what? Because of my depression, I am eating the things that I don't want to eat. I'm not exercising. My sugar is going to go up, right? Yes, you're going to say, okay, how is it that your sugar is not being managed? Why is it that you don't want to exercise? And then you start digging in and you realize that this individual is depressed. Because people who are depressed, they don't want to, they lost interest in the things that they normally used to love doing. Yes. They don't want to move. They just feel overall, they're always tired. There's this nature of just wanting to lie down, be sedentary. You don't even want to go out, you just cry. And then some people eat a lot. So if I put you on a particular diet for your maybe say you're on a diabetic diet, it's not sugar friendly, but then you want to binge on ice cream, there's a problem, right? So we see that connection right there. My depression can affect my diabetes in that way. And many other things. If I have cancer, if I've been diagnosed with cancer and I know it's a terminal disease and they tell me I have 6 months to live, it can throw me into depression right away. Which is why when we always do a diagnosis of like a terminal disease, we get the psychologist involved to begin to prepare your mind. Do you know what it means to know you're going to die? Some people can handle it. Yes. The family members even can handle it. So there's that always constant relation. Let's talk about heart disease. Your heart. When you're emotionally distressed, what do you say? You say, my heart hurt.
My heart hurt.
You feel it. You feel the pain there. There is a connection. We have, I talked about Takasubo's cardiomyopathy, which is an emotional state that induces something that you feel like it's a heart attack, but it's not. Have you ever faced a breakup? You feel like you can't breathe. Yeah. You feel like you're dying, like you literally, I can't breathe, you see? But it's your mind, your state of mind. It's affecting your heart rate. It's affecting your breathing. It's affecting a lot. And you sure can die if you don't take care of it. So in every way, these things are connected. Stress weakens your immune system. Anxiety and stress weakens your immune system. And when your immune system is weak, you don't have the fighting white blood cells that are there to protect you. Yeah. Anything you can catch, any infection, you get it. If it is in the air, by touch, contact, all of that, you catch it easily. So you find somebody who is depressed might also now start presenting with other things like a lot of flu, a lot of colds, and even people who are, let's say, neutropenic, their white count is low. You can't even go closer to anyone, even plants, because you can easily catch anything, even just going through live plants. We typically don't let you get involved with that. So if your immune system is weak, you're prone to many physical diseases that will come your way. And then we can keep going, and I can link every single thing. We can keep getting this link. So it's like a loop. We can't separate them. We can't say one is better than the other. We can't say, oh, your mental health is better than the other, because you can be your physical health, like you can be healthy, or you can have all the things, your condition criteria for your life met. But if you're not happy, you don't enjoy those things. You can have a six-pack, but then you jump out the window because of a different psych concern. You can have so much money in the bank, but you stand in front of a moving train because your mind is not well. So you can't separate the two. I feel like the two are equally important, which is why I specialized in one, and then later on saw the need to go specialize in the other. So I'm trying to bring it all together in a way that is very, very intricate to our overall mental and physical health well-being. Yeah.
You spoke a moment ago about personnel, people to handle mental health challenges, and you're working on the mental health first aid certification program. What is it all about?
Oh yeah, so the mental health first aid certification is a certification that teaches individuals how to identify individuals who are struggling with mental health challenges. You're able to identify that, oh my gosh, I noticed that this individual is in distress, and then respond appropriately. Because when it comes to mental health, if you don't respond appropriately, you might actually affect the individual negatively. And then know how to connect the individual with resources that they need to get the kind of care that they need. It is likened to CPR, all right, for physical health. So mental health first aid is to mental health what CPR is to physical health. Now, CPR, for those who don't know, is just a certification that you get to be able to know when somebody's in physical health, when you're having a physical health distress. So, for example, a heart attack. Maybe you're choking in public. Nobody's there. Nobody knows. You get this certification. I know, okay, oh my gosh, this person is having a heart attack, or they're unresponsive. They're on the ground. I try to wake them up. I can't get a pulse. I know exactly what to do. I need to start chest compressions immediately, and then call for help, and then defibrillate if I have to. But all of these things you only know because you got certified. For you to even identify that someone is going through distress, you have to have gone through some kind of training. Thereby, the certificate just tells you that I am trained to offer CPR. Now, when you get certified, mental health first aid certified, you already know the signs and symptoms to look out for. You already know when somebody is depressed, or somebody's contemplating suicide, or somebody's going through post-traumatic stress disorder, somebody's having a panic attack, a full-blown panic attack. What will you do? Or what if I walk up to you and tell you that I want to kill myself? So many people don't know what they'll do. They'll feel uncomfortable. They'll be like, oh my, like
confused.
So, but when you're trained, immediately you know who to call. You have the resources at hand. You have the hotline to call, and you know how to speak to this individual. What if you meet somebody on the bridge about to jump? There are ways you have to approach them. That way they don't actually just jump on you. There are ways you know how to speak the language that they will understand without making them feeling bad or judged, or, you know, make them feel bad even more. The language is very particular. For example, even though I was a clinician, I didn't know that it's not appropriate to say you committed suicide. The language is very judgmental. The right way to say is died by suicide. Because this individual, when you say commit, we always say commit a murder, commit an abortion, So it's always like we're judging you, we're making you feel bad, like you did a bad thing, how dare you, right? But this person died by suicide. They were sick. It's not like they were going through something. Unfortunately, we didn't get through to them on time. At times, some people reach out in ways that we don't understand because we're not trained. If somebody starts telling you that, you know what, don't worry about me, I won't be around. I mean, you don't have to worry about me anymore. Very soon, you won't have to worry about me anymore. Or they're giving away their possessions. They're giving away, if somebody has a pet that they love, they say, you know what, you can have it. It's okay. Or they start calling individuals and straightening out their wills and making sure that they have all their affairs in order. A trained mind will instantly start getting concerned, and they won't just attack you like, what do you think you're doing? Why? No, they'll be like, hey, I noticed that you're giving away your beloved pet. Is everything okay? Do you want to talk about it? You know, it's something. So somebody who is trained can pick on those things. Their consistency in their habits change. Things that they used to love, they don't love anymore. Things that they used to do. So you begin to notice these changes. Somebody who used to sleep, you know, for 8 hours can't sleep anymore. the tossing and turning, especially for family members who can notice those close changes. When your mind is trained, you can pick these things and you can help somebody because you can connect them with professional help. Because when it gets to that point, you definitely need professional help. So, yeah.
All right. Before we go, I would like to give you the ball. Do you have any last words for us?
All right. Last words. For me, personally, I just have words of gratitude for what we've achieved so far and the ability to be able to come and do the things that we have to do for the community and for the country. I just have nothing but gratitude, and just want to thank you all for the opportunity, because the best way to get information out to the masses is through media. And what we do here is going to be heard by many, and it's also achieving the overall goal for what we're about to do, to help so many people get the information so that they begin to do the things they need to do. So all I have is thank you.
Right. Thank you to Venetta Mwegella, the founder and CEO of the Venetta Mwegella Foundation. And of course, we shall see you some other time when you come back to Cameroon. And to you, televiewers, it was a pleasure being with you in this edition of the program. We urge you to keep watching Dash News, the Voice of Africa. Bye for now.